Hello, good morning, everyone, and welcome, good afternoon or good evening to this special press conference brought to you by the Africa Centers for Disease Control and Prevention. My name is Wayne Musabayana, and I am the Head of Communication at the African Union, and I will be your moderator for today. Our host, as usual, is Dr. John Nkengasong, and he is the Director of the Africa CDC. Today he's going to be giving us the update, but he will also take some time to dwell into the issues of vaccines. We are aware that some vaccines have started coming into our continent, and so he'll be giving us the update on that, as well as developments elsewhere on the continent. We are coming to you on Facebook, on live stream, on YouTube, and on Twitter, and that is on the African Union channels. For the Africa CDC, we are coming to you on Twitter, on YouTube, and on Facebook. And we are also using two languages today. Those are French and English. So please feel free to choose the language of your choice. When we come to the question and answer session, kindly use this WhatsApp number, +251 94 550 2310. I'll give you that number again, +251 94 550 2310. Alternatively, you may want to ask us your question live on this platform, or to use the question and answer platform on this Zoom platform. All right, now let me bring in our host, Dr. John Nkengasong.
Thank you, Ryan, and greetings to all of everyone else on this platform today, as usual. Let me start by expressing my sincere gratitude to our healthcare workers and responders who are all over the states to this pandemic. The healthcare workers in member states, the ones that were deployed, again, as we stated before, Africa CDC has deployed over 15,000 healthcare workers in the field. These are community healthcare workers. We've also deployed about 300 responders. So that's a lot of people out there in the front line working very hard as we fight the second wave of the pandemic. I would then also like to, as always, truly express my sincere gratitude to all of you who have worked together with us in the true spirit of coordination and collaboration to make sure that the right information and accurate information and timely information is propagated to all member states. This week is very special for Africa CDC. We are celebrating our 4 years anniversary. Exactly 4 years ago, on January 31st, 2017, the head of states launched the Africa CDC as a specialized technical institution of the African Union. I always characterize the Africa CDC as one of the greatest political innovation that was inspired by the vision and wisdom of our head of states. At that time, Ebola had, the continent had just fought a very fierce battle against Ebola in West Africa. And I'm sure they knew that the future was going to be characterized by other pandemics. So they launched Africa CDC. We are really truly humbled. Those of us who were called on to be pioneers in setting up the Africa CDC, the opportunity to truly contribute a resilience in setting up an organization that was just an idea curtain at the African Union. So join us, colleagues, in celebrating our 4 years anniversary that has been full of action and impact across the continent. So on that, I would like to come back to the topic of the day, which is the update on COVID-19. As of 9 a.m. East African time, the world has recorded 103 cases of COVID-19, of which 2.2 million people have unfortunately died with a case fatality rate of 2.2%. Now, when this pandemic just started last year, indicating that 1,000 people had died was very troubling. My fear today is that with the large number of deaths that have occurred, this begin to become numbers rather than people. I would like us to continue to remember that these are individuals, they are loved ones, they are sisters, mothers, brothers, uncles, really, and to put a face to these numbers so that they cease from being just statistics. That is my greatest, it will be a tragedy if we begin to normalize these deaths going forward. So that just means to me that we have to redouble our efforts to fight so that no one person dies from COVID going forward. I think it should be a common commitment that we say, I will protect myself, I will do the right thing so that I can protect, deny the virus the space to spread. By doing that, we'll be decreasing mortality. On the continent of Africa, 3.6 million cases of COVID-19 have been reported, representing about 3.5% of the total cases globally. And of that number, 3 million recoveries have occurred, and that is 86% of the total cases that were infected that have recovered. Unfortunately, also in Africa, 93,000 individuals have died from the COVID-19, and leading to a case fatality rate of 2.6%. So again, the global case fatality rate is 2.2%. The continental case fatality rate is 2.6%. That shows you clearly, as I indicated last time, that our case fatality rate is becoming very troubling because it has now exceeded the global total. It used to be the reverse. We used to, during the first wave, the case fatality rate was about 2.2%, and now we are seeing a 2.6%. In terms of the number of countries experiencing the second wave, 41 of them are currently experiencing the second wave on the continent. That is 41 of the 55 member states. 5 countries that are accounting for about 70% of the caseload: Africa with 1.4 million cases, or 41%, Morocco 13%, Tunisia 6%, Egypt 5%, and Ethiopia 4%. The number of countries with case fatality rates that are high of 2.2% continue to increase. 2 additional countries were added to the list this week, for a total of 20 countries, or 36% of the countries that are experiencing a case fatality rate of more than 2.2%. And I'll just read through them because it's very important. Sahrawi Republic, Sudan, Egypt, Liberia, Mali, Zimbabwe, Eswatini, Comoros, Niger, Chad, Tunisia, Gambia, South Africa, Malawi, DR Congo, Somalia, Algeria, Mauritania, Senegal, and Angola. So when we now look at the last 4 weeks, that is the week between January 25th and 31st of January, we observe that overall we see an increase of 26%. We see that we have recorded 130,000 new cases and 5,600 new deaths reported on the continent. And it represents a 26% decrease in cases and 10% decrease in deaths over the previous week 3 of 2021. Again, a lot of this decrease is because of what we are seeing in South Africa, where there is bending the curve. South Africa again represents 40% of our the pandemic across the continent. The highest proportion of new cases reported for the week was from Southern Africa, that is 54%, followed by Northern Africa, 21%, West Africa, 16%, East Africa, 7%, and Central Africa, 2%. 5 countries accounting for the highest number of new cases included South Africa, 40,000, Tunisia, 11,000, Nigeria, 9,000, Zambia, 8,000, and Mozambique 6,000. So when we look at the week between January 4th and January 31st, and look at the 4 regions, we see that an overall average decrease of 4% have occurred. And by region, we have recorded a 6% increase in Central Africa, 11% increase in East Africa, 8% decrease in Northern Africa, 7% decrease in Southern Africa, and 22% increase in West Africa. Over the last 4 epidemiological weeks, we have noted the following trends in the most populous countries on the continent. Nigeria has reported an 18% average increase, Ethiopia 13% average increase, Egypt 18% average decrease, DR Congo 3% average increase, South Africa 15% average decrease, and Kenya 4% average. In terms of that, Nigeria has reported over the last 4 weeks 11% average increase, Ethiopia 13% average decrease, Egypt 20% average decrease, DR Congo 8% average decrease, South Africa 16% average decrease, and Kenya 41% average decrease. So as of this week, a total of 31 million COVID tests have been conducted on the continent. And the 10 countries that are conducting in excess of 70% of the testing include South Africa, Morocco, Ethiopia, Nigeria, Kenya, Egypt, Zambia, Cameroon, Tunisia, Uganda, Rwanda, and Ghana. And this represents a 3.5% increase over the figures of last week. In terms of capacity, we continue to support member states across the board in the areas of infection prevention control. We held a 40th session of clinical community of practice where we continue to train 130 participants on infection control and managing the infections. Let me just conclude then by giving you an update on vaccines. So the picture on the continent is looking like as follows. Morocco launched its COVID-19 vaccination on the 28th of January after receiving its first shipment of AstraZeneca vaccines. South Africa received its first consignment of 1 million doses of the Oxford AstraZeneca vaccine from the Serum Institute in India on the 1st of February. Algeria on January 10 also received vaccines. Guinea-Conakry received vaccines from January 29, Tunisia on the 30th, and they've all registered the Gamaleya Institute, the Sputnik vaccine, for emergency use authorization. So all 3 countries, i.e. Algeria, Guinea, and Tunisia. You probably have seen our communique. We've now established our Africa CDC regulatory task force to facilitate emergency approval of vaccines for the continent and provide a pathway for countries to approach us to address issues related to approval of vaccines or for emergency use. With respect to AVAC, that is the African Vaccine Acquisition Task Force or Task Team, on that platform, that is the AMSP, the African Medical Supply Platform, 16 countries have now expressed the interest to place their orders. And that means they've submitted their files with the quotation of what they need for a total of 114 million doses of vaccines from those 16 countries. We are in an aggressive campaign mode to encourage other countries to express their interest through the platform. That way negotiations can start with a financing facilitation from the Afro-Exim Bank. So that is the update I have for you. I look forward to addressing any questions you may have or concerns that may arise. Win, back to you.
Thank you very much, John, for that update. And congratulations indeed as we celebrate the 4th anniversary of the formation of the Africa CDC. We have a congratulatory message coming from Lillian Luwaga, and she just wants to say happy anniversary, Africa CDC. Congratulations and thank you for the great work that you are doing. Congratulations. Thank you very much, Lillian, for that. Now, our first question for today is coming from Joao Foster, and Joao is with the German press agency. Firstly, when do you anticipate the first delivery of vaccines arriving through AVAT? And a follow-up, many countries in the global north have long started their vaccination campaigns. Why exactly is it taking that much longer for most African countries? She goes on, how are the talks going with China and Russia regarding their vaccines? And finally, do you anticipate that AVAT will also secure those vaccines from China and Russia anytime soon? So that's from Joao Foster, German press agency.
So thank you for those series of questions. As you heard me stated, we remember it's just I think 2 weeks ago that we announced the President Ramaphosa announced that we had secured the 270 million doses of vaccines, and so that is how we're establishing the process and systems is going on. You heard me mention that 16 countries have expressed interest by submitting their applications, and those discussions will be happening. Our hope is that in the next 2 to 3 weeks, they should be having their vaccines, because this is an emergency. So, but I'll keep you updated on, of course, regular basis. It is our priority to make sure that these vaccines are delivered in a timely fashion so that countries can start vaccinating. But I cannot give it a specific date that the vaccines will be arriving. You know, as always, that if once we know that information, you'll be the first to know. Why has Africa not started the vaccines? Well, we haven't started because we didn't have the vaccines. We all know what has characterized the landscape of vaccines in the world, that some countries place a very important pre-market procurement or commitments that made it difficult for the vaccines to be available in Africa. So, but that situation is improving. I think we will be through ADVAC and COVAC. I remain optimistic that in the coming weeks we'll start actually rolling out vaccine. I think we celebrate every literary action that occurs on the continent, with South Africa having the first 1 million doses of vaccines. We continue to work with the Serum Institute and Pfizer to get what we can get to start the vaccination. The key thing is to get started. And I remain hopeful that we will get started in the coming weeks, not months. With respect to China and Russian vaccines, again, I want to say this very clearly. We are open to any vaccine manufacturers to discuss with us. I indicated earlier that we have set up our own regulatory mechanism to address the need to quickly advise countries on vaccines, which means we now have an expert committee that can review the dossiers and make a pronouncement and advise on how the vaccines should be used, and based on 2 criteria, which is safety and efficacy. So we now have the dossiers from the Russian manufacturer, and you perhaps saw the results published in the Lancet just this week, showing an efficacy of about 91%. That is very good. We have signed a confidential agreement with them to review the data, and we will be doing that this week. And I think I'm very pleased and we have also engaged with other countries, manufacturers, so that they can submit their dossiers to us quickly. That is the Johnson & Johnson and Pfizer, AstraZeneca, and Novavax. With respect to China, the China manufacturers, we've written to them through both official channels at the AU and through the vaccine manufacturers to get their vaccine, know more about the vaccines, and also work with them to get their vaccines accessible on the continent. As if you recall, Egypt, Morocco are also going to be using the vaccines from China, and I believe Seychelles is also doing that. So we're offering a platform, a continental platform for regulation, a continental platform to review the data that these companies have produced. We are totally open to working with any vaccine manufacturer on the only two conditions: show us your dossier, let's review the safety data and also the efficacy data. And this is in collaboration with WHO and the AU NEPAD. Guidance on how to approach different vaccines. So if someone was to approach country Nigeria, what are your options? So the first thing you ask is, have the vaccine been received emergency approval from WHO? Yes, it's a separate category. If the vaccine has received an approval from an authoritative body like the United States FDA, that is a different category. And then if the vaccine has not, then we are here to help you work with them to review the dossiers and advise them. So countries are not helpless. I mean, they have the platform within Africa CDC to do that. And again, those two instruments are on our websites, namely the communique indicating that the whole process of approval, a committee that is in place and a task force for that. Then secondly, is the entire guidance document. So I strongly encourage you to help us spread that word out there and use your different outlets to share with member states.